Hi everyone, as part of Women's Health Week, today we are talking about the menopause. So menopause happens when your ovaries stop producing hormones and releasing eggs. So when these ovaries stop working, there'll be a drop in your blood level of this hormone. And as a result, this disrupts your periods and causes many symptoms which can be associated with the menopause. So typically this happens between the age of 45 and 55, but it is possible to have this sooner and can also be sooner, such as the treatments of cancer or surgical treatment. They say about 80% of people experience symptoms of the menopause, and 25% of that have severe symptoms. And some people can experience hot flushes for up to 7 years, so quite a fair time. So, what actually are the symptoms, and when will you know if you're going through the menopause? So the biggest way to determine this is from a change in periods. So people can go through long periods of time without having them. Hot flushes are also very common, particularly at night. So you get a lot of sweat and disturbed sleep. You can have low mood and anxiety. Memory problems and concentration problems are also common. So I've heard a lot of people say that they experience times when they can't remember what they were going to do, and it can take them quite a while to get back into that kind of mentality of what they were actually doing. You can get aches and pains, skin irritation, and other things such as vaginal dryness, itching, discharge, all of which can be very uncomfortable. Other people experience low sex drives or even painful intercourse, and urinary urgency and frequencies can vary as well. So going to the toilet more or having some kind of pain when going to the toilet. So what can you do to minimise the effects of this? So the main way is to have a healthy diet. This protects both your bones and the heart. Take regular, moderate physical exercise. So it could be walking, cycling, dancing, whatever you need to do to keep yourself active and getting your heart rate up. Maintaining a healthy weight is also very important. So this links into the diet and the exercise. Stopping smoking and limiting your alcohol intake. You also need to make sure you're taking breast self-examinations because the risk of breast cancer can be increased, and take part in the NHS screenings for this. Other ways can you minimise the effects, Tom?
So, as we mentioned, obviously living a healthier lifestyle can definitely really help yourself when you're going through this period. So, eating sort of at least 5 portions a day of fruit and vegetables, including that low GI or the glycemic index carbohydrates, such as sort of brown pastas, brown rices, oats, pulse, grains, pastas, breads, etc. But mainly sort of high emphasis on the whole grains. Also, you can eat more phytoestrogen rich foods, things like soya milk, and they contain the estrogenic properties of these foods. So when you do take these in, it almost can reduce your symptoms when you do go through this period. You can also include 2 to 3 daily servings of low-fat dairy foods, things like the soy alternatives or your yogurts, things like that, to maintain your bone density as well. And of course, eating oily fish at least once a week is sort of recommended. Roughly around 2 to 3 times a week you should be eating some form of oily fish. So it could be salmon, it could be tuna, anything sort of along the lines of that.
So quite easy things as part of a healthy diet anyway, really.
Absolutely, yeah.
Perfect. So do I need to see a doctor if I think I'm going through the menopause?
So most women do breeze through menopause and they don't even realize sort of, they're on it. They don't really experience some symptoms. Some have mild symptoms. But if your symptoms are causing you problems and you do have any pain or discomfort, definitely see your GP. They can help you sort of discuss all your options that you can go through. We're going to go through a few in a minute, sort of some options that you can go through. But definitely, if you are getting those symptoms and you're also having troubles or problems with those symptoms, then please do, yes, go see your GP.
And what about contraception? Do I still need to take this?
Yeah, so most women under 50 are advised to continue with the contraception for 2 years after their last period, but it is good to keep a note of your last period and make sure you're sort of keeping a diary. There's a lot of apps out there at the moment that do sort of keep diaries of these kind of things, so you can definitely keep tabs on what it is.
And what about the treatment options? I've heard a lot about HRT.
Yeah, so HRT is your hormone replacement therapy. It is the most effective treatment. It does involve you taking estrogen to essentially alleviate your symptoms. It does help with the hot flushes, all the different risks of osteoporosis, which is essentially your brittly bones, any bone or achy joints, your mood swings, any bladder symptoms, all those kind of things. I mean, you've got them all listed down here, but so HRT is the most common and most effective way, but there are definitely more and other sort of options that people do go down, which will go on, I believe, in the next slide. So the risks, again, before we do jump onto that, you can get blood clots, can get strokes, breast cancers, heart disease, ovarian cancer, etc. So that there are a few with minimal or some research behind whether they do affect or have these specific risks, but it's not. I mean, I don't want you guys to feel like, oh my God, if I do it, I'm going to get cancer. It's not as simple as that. There have been a few cases that have come over with those kind of symptoms and sort of risks and come out with that in the end. But overall, it's usually the most common and the most effective way of treating menopause.
So it's best just to discuss it with your GP, really, I guess, and see if it is a risk to you.
Yeah, if you have any sort of hereditary or sort of risks in the family of certain diseases or conditions, then they will sort of take that into consideration and they'll advise the best route according.
So should I take HRT? So I guess we've kind of covered that already. I
Yeah,
guess it's generally checking in with your GP, and like you said, seeing if it is a risk to you.
indeed. Yeah, making sure that you obviously do remember you still do need contraception, and that's the main important thing. And obviously speaking to your GP about that, it is really important. You can't make that decision on your own necessarily, but definitely with the help of your GP, you'll be able to make an informed decision.
So going on to the alternative. So if we don't want to take HRT, what other options are available?
Yeah, so lots of other different alternatives. A lot of them are herbal. So you've got your herbal ones, your evening primrose and your St. John wort. So there's a few different sort of plant-based herbal options that you can go down, which do help to reduce these risks and these symptoms of menopause. You've got your phytoestrogen as well, which I mentioned earlier, comes on with things like soya and red clover. They are essentially just your organic ways to get those estrogen levels up in your body that your body is basically lacking. Many of them not proven completely to be safe or effective, but they are definitely something that you can do naturally without taking or consuming anything sort of given by your GP. Can have interactions with other medications as well, but also you're looking for the traditional herbal registration on the packet. So the THR, if it's got that on the packet, it just means it is essentially sort of for that reason, and you can't really go wrong with that way.
So hi Sharon, thanks for joining us today. As you know, this week we're talking about the menopause, and we'd really like to hear about your experiences. So statistically, most women go through the menopause in their late 40s. How old were you?
I was about 42 and a half.
Oh wow, that's quite young.
Yeah, but I wasn't really surprised because I am a mum to twins. There's been lots of research, but a leading one by Harvard University found that the natural menopause was significantly earlier amongst mums of multiple births as opposed to like mums of singletons. And they also found that twins are 3 to 5 times more likely to have an earlier menopause, the average age being 40 to 45, especially if they are twin sisters. But the good news is twinning is winning, as both mums of twins and twins not only have a best friend for life, but studies have shown that they do live longer than singletons, so it's not all bad.
Interesting stuff.
Yeah.
So what symptoms did you have, and when did you realise it was down to the menopause?
It was hard, really, because my dad died really suddenly just before Christmas, and being a daddy's girl, my world absolutely fell apart, and my period just like didn't happen. So to start with, I thought it was to do with that. But it appeared 2 months later, and say I just put this lateness down to the stress and shock of losing my dad. And whilst I had that familiar dull ache in my stomach every month, the next one wasn't for another 7 months, and then 4 months, and each time it was all over the place, and the bleeding was very light and sometimes only for a few hours. But at the same time, I was experiencing hot flushes at work and sometimes felt like I was going to pass out. I was so hot at night and found it difficult to sleep. And every morning I was going to work absolutely shattered. So at the weekends, I was taking night nurse just to knock me out, just so I could get some sleep. But also my memory became awful. I've always had a good memory, but sometimes I'd go upstairs 4 times before I remembered that it was coat hangers I'd actually gone upstairs for, even though I was in the middle of ironing. And then to top it all, I wasn't eating very much, but I was putting on weight. So my self-esteem kind of went down the pan, and I was quite tearful at times and didn't really think much of myself, It's just generally, I kind of really felt all at sea and just not really myself.
God, I'm really sorry to hear about your dad, and it sounds like you've had some pretty rough symptoms. So what did you do about it?
Not a lot, to be honest. I mean, I didn't go to the doctors because I don't really like going to the doctors anyway. And I kind of came to my own conclusion that maybe I was going through the menopause. But when I did eventually go to the doctors for an annual checkup, because I was kind of getting to that age, I did mention it to them, and they agreed that yes, I probably was going through the menopause. Because I went through quite so early, I did actually find it quite hard to talk to my friends about it, because obviously they didn't know what I was talking about. I remember when I was younger talking to people who were at that stage in life, and they were going on about hot sweats and not being able to sleep. I kind of didn't exactly roll my eyes, but just thought, oh, and that was it, But I did start talking to my sister-in-laws as they were older than me, and I did lots of Googling. And as a result of all that, I decided that HRT wasn't for me. And I'd look at going down the herbal route and maybe adjusting my diet to include oily fish, calcium, yogurts, that kind of stuff. And the reason I did that was because the worst bit for me was just the lack of sleep and being so hot at night and going to work shattered. Everything else, like the memory loss and the weight issues, I thought I could live with. So as a result, I began taking sage tablets, which were quite pricey as far as vitamins were concerned, because they were £14 a month. But then at that point, I'd have done anything just to get some sleep. Well, I've got to say, within 2 weeks, the difference was really noticeable. It wasn't a total cure, but sleeping was better, and I wasn't as hot at night. Moving forward, then I also changed my bedding to white sheets and cream sheets, because of obviously light colours you traditionally kind of wear in summer to keep you cooler. And I bought a lower top duvet, breathable pillows, and my best purchase was the JML Chillax pillow, which keeps you cool at night. But if you haven't got that, you can use a cold water bottle, which you can put in the freezer before you go to bed and take that with you. It's great. It really does keep you cool. Most of this, obviously, because I was sleeping a lot better, I was able to face whatever the day would bring. And working in a secondary school, every day is eventful.
Thanks for that, and thanks for being so honest. You gave some really great tips there.
Okay.
So finally, what advice would you give women who are going through the menopause or will be going through the menopause later in their life?
I'd say kind of to talk to other people. I think the worst thing is that you kind of feel quite alone, and at times you feel like you're absolutely going mad. And I think if you do talk to other people, you do kind of pick up lots of tips, like the hot or cold water bottle, I should say, I wouldn't have thought of that, and that did make a big difference. Talk to medical people, but also, look on the internet as well. Do your research, because everybody goes down like a different route, and everyone is totally different. There's no right answer, and we're all individuals. Try stuff, and don't be afraid to ask for help. But overall, my top advice would be, don't be hard on yourself. Yes, you will put a bit of weight on, but be kind to yourself. Talk to family and friends about how you feel and what's happening to you. And despite juggling work and family life, which we all know is mad at times, just find some time to do what makes you happy, and maybe a spa day in between.
Couldn't agree with you more. No, really great tips there. I think people could take a lot from that. So thank you for your time. And I'm sure if anyone's got any questions, we can pass them on.
Okay, fantastic.